You sit down at home, wrap the cuff around your arm, press the start button, and wait. The monitor shows a number that is much higher than you expected. You feel concerned, so you try again a minute later. This time, the result is noticeably different. Which reading should you trust? And why did the number change? Home blood pressure monitoring can be extremely useful. It can help you and your healthcare professional see patterns that may not be obvious from a single office visit. But the device, the cuff, your preparation, your posture, your arm position, and even whether you are talking can affect the usefulness of the result. The first thing to understand is that one blood pressure reading is only a snapshot. It shows what your blood pressure was at that moment. It does not by itself diagnose high blood pressure. Only a qualified healthcare professional can confirm a diagnosis by considering repeated measurements, your medical history, and the larger clinical picture. Blood pressure is dynamic, not fixed. It changes throughout the day as your activity, stress level, sleep, pain, hydration, medications, and other factors change. Even two correctly taken readings may not be identical. That does not automatically mean the monitor is broken, and it does not mean you should keep checking until you get the number you want. The purpose of good technique is not to eliminate every difference. It is to reduce avoidable measurement error so that the pattern becomes more meaningful over time. So let's walk through 7 common mistakes that can make home readings confusing or less reliable. Mistake number 1 is using the wrong monitor or the wrong cuff. For most adults, the standard choice is an automatic, validated monitor that uses a cuff around the upper arm. Wrist and finger devices are generally less reliable for routine home measurement unless a healthcare professional has recommended a specific device for your situation. Validation matters because a device can look professional and still not have been independently tested for clinical accuracy. Before buying a monitor, check whether the exact model has been validated or ask a pharmacist or healthcare professional for help. The cuff also has to fit your arm correctly. A cuff that is too small or too large can distort the reading. Do not choose a cuff based only on labels such as standard or large. Measure around your upper arm. Compare that measurement with the manufacturer's cuff range and make sure your arm falls within it. After buying a monitor, bring it to a medical appointment. Ask a healthcare professional to confirm that you are using it correctly and that its readings are reasonably consistent with the equipment used in the office. Mistake number 2 is measuring without preparing first. Blood pressure responds to what is happening in your body. If you just climbed stairs, finished a workout, rushed through traffic, smoked, used nicotine, or drank caffeine, your reading may be temporarily different from your usual resting level. As a general rule, avoid smoking, caffeine, and exercise for at least 30 minutes before checking. Empty your bladder, then sit quietly for at least 5 minutes before starting. Do not use those 5 minutes to answer work messages, argue on the phone, or hurry through household tasks. The goal is not to force your blood pressure down. The goal is to measure it under calm, repeatable conditions. Mistake number 3 is using the wrong chair or posture. A soft couch, the edge of a bed, or a tall stool may feel convenient, but they often make correct positioning difficult. Use a chair that supports your back. Sit upright, but relaxed. Place both feet flat on the floor. Keep your legs uncrossed. If your feet do not comfortably reach the floor, use a stable foot support. Avoid leaning forward, balancing on the edge of the seat, or tensing your legs. Your body should be supported because unsupported posture can change the reading and make it harder to compare one measurement with another. Mistake number 4 is placing the cuff incorrectly. The cuff belongs on the bare upper arm, not over a sleeve. Even thin clothing can interfere with placement and fit. Follow the instructions for your exact monitor. In general, the lower edge of the cuff sits just above the bend of the elbow, and the cuff should be snug without painfully squeezing the arm. Do not roll up a tight sleeve that constricts the upper arm. It is usually better to remove the arm from the sleeve completely. If you are unsure about placement, ask a healthcare professional to demonstrate it. A correct cuff in the wrong location can still produce a less useful result. Mistake number 5 is letting the arm hang or placing it at the wrong height. Your arm should rest comfortably on a table, desk, or firm cushion. The middle of the cuff should be approximately level with your heart. Do not hold your arm up using muscle effort, do not let it hang beside your body, and do not balance it awkwardly on a surface that is too low or too high. The goal is a relaxed, supported arm. If needed, use a folded towel or pillow to bring the arm to the correct height. Mistake number 6 is talking moving, or using your phone during the measurement. Once you press start, stay quiet and still. Do not talk to someone in the room. Do not answer a call. Do not scroll, type, or react to a video. Keep your hand open, your arm relaxed, and your body still until the monitor finishes. This may sound like a small detail, but blood pressure measurement is sensitive to conditions. A calm, quiet routine gives you a better chance of comparing today's reading with tomorrow's under similar circumstances. Mistake number 7 is reacting to one number or checking chaotically. A single high reading can be concerning, but it is not automatically an emergency, and it is not proof that you have hypertension. If a reading is higher than expected, stay calm. Make sure your position and cuff placement are correct. Wait at least 1 minute, then take another reading. For routine home monitoring, many current recommendations suggest taking 2 readings about 1 minute apart and recording both. Your healthcare professional may recommend a different schedule based on your situation, so follow their instructions about when and how often to measure. Try to measure at roughly the same time under similar conditions. Do not check every few minutes because anxiety is rising. Repeated, panicked checking can create more confusion without giving you a useful long-term pattern. Now let's put the complete routine together. Use a validated automatic upper arm monitor with the correct cuff size. Avoid smoking, caffeine, and exercise for at least 30 minutes beforehand. Empty your bladder. Sit in a supportive chair with your back supported, feet flat, and legs uncrossed. Rest quietly for at least 5 minutes. Place the cuff on your bare upper arm. Support the arm so the cuff is near heart level. Stay quiet and still. Take the number of readings recommended for you, commonly 2 readings about 1 minute apart, then record the results. A useful record may include the date, time, both readings, and anything unusual that could have influenced them, such as illness, poor sleep, pain, unusual stress, or a missed medication dose. Do not change medication on your own, but accurate notes can help your healthcare professional interpret the pattern. Some monitors store results automatically. Others require a written log or a secure app. The method matters less than keeping a clear, consistent record that you can bring to an appointment. Home monitoring supports medical care. It does not replace it. Do not start, stop, skip, double, or change the dose of a blood pressure medication because of a home reading unless a qualified healthcare professional tells you to do so. Correct technique can improve measurement, but it does not make every high reading disappear. Persistent or repeatedly concerning readings deserve professional evaluation. There is also one safety situation you should understand. If your blood pressure is higher than 180/120, wait at least 1 minute and measure again. If the second reading remains that high and you have symptoms such as chest pain, shortness of breath, back pain, new weakness, numbness, vision changes, difficulty speaking, or another new and concerning symptom, call 911. Do not wait to see whether it improves on its own, and do not drive yourself during a possible medical emergency. If the repeat reading remains above 180/120, but you do not have those symptoms, contact your healthcare professional as soon as possible for guidance. The goal is not to panic over one number, and it is not to chase a perfect reading. The goal is to create a calm, consistent, technically appropriate record. Use the right device. Use the right cuff. Prepare first. Sit correctly. Place and support the arm correctly. Stay quiet. Repeat and record the reading in a consistent way. That record can support a clearer, more useful conversation with a qualified healthcare professional. If this video helped you understand home blood pressure measurement more clearly, please like the video and subscribe to Health for Legacy. Your support helps us continue producing careful, evidence-based health content without hype or misleading promises. Thank you for watching. Until then, live stronger, age better. Stay safe, stay healthy, and take care.